Welcome to this Newswise Live Expert Panel. I'm Tom Canalicchio here with Newswise. We have with us today 6 panelists to discuss various topics related to mental health and the current pandemic, as well as the recent protests involving the Black Lives Matter movement and how all of these things converge to impact people's mental health, as well as psychological research. I want to introduce our panelists and then go over a few instructions and notes for our participants today. So first, to introduce our panelists, we have Dr. Carl Weems. He's professor and chair of the Department of Human Development and Family Studies at Iowa State University. We also have Dr. Roxanne Cohen-Silver. She's professor of psychological science, medicine, and public health at UC Irvine, and she's also a fellow with the Association of Psychological Science, and her participation today has been made possible with the help of the Association for Psychological Science. We also have Dr. Vaile Wright. She's Senior Director for Healthcare Innovation at the American Psychological Association. Next, we have Dr. Olga Acosta Price. She's Associate Professor in the Department of Prevention and Community Health at George Washington University. We have Dr. Nadine Kaslow, Professor of Psychiatry and Behavioral Sciences at Emory University. And Dr. Kaslow is also a former president of the American Psychological Association, and her participation today has been made possible by our contacts at the APA. And last but not least, we have Dr. Nicole Mavrides. She's assistant professor in the Department of Psychiatry and Behavioral Sciences, and she's also medical director of Child Psychiatry and Consultation Service at the University of Miami Health System. Thank you very much to all of our panelists for joining. The combined crises of these 3 converging events, the pandemic, the economic consequences, and these Black Lives Matter protests, seems to be an amplifying effect. What have we learned from these other past crises that gives us insights into that?
I think that we're seeing a set of cascading traumas, a cascading set of collective traumas that may seem for many people almost too much to bear. First, we have the pandemic, and right at the same time as we crossed 100,000 deaths in the United States, we had about 40 million individuals unemployed, and within a week or 2 after that, we had the George Floyd video that filled our feeds, both our social media and our traditional media feeds. And that combination of crises is really unprecedented. We have very little information to go on in which we understand how people respond to this unfolding disaster. However, from a variety of prior crises, we do know that in general, the public is quite resilient, and I would expect that many people will look back on this 2020 and the first 6-7 months of 2020 and be able to see how resilient they were in coping with all of these combined crises.
Thank you, Dr. Silver. I want to go next to Dr. Weems. Dr. Weems, you study especially traumatic events and adverse events in childhood. So we've obviously had major disruptions to the school year and parents and students coping with that, as well as these other crises, the economy and the Black Lives Matter protests. How do these events potentially shape children's response to these events for years to come, and what kind of long-term impact can be seen or predicted based on previous examples?
Thanks. Again, thank you also for having me here. Well, it's a complex question, and we know from previous research that the experience, the pre-existing conditions that children bring to an event like this will influence it. To build on what Dr. Silver was saying, we expect some level of youth to be resilient. Sometimes that number is less than what we think it might be. particularly for those who have pre-existing conditions. For example, our research shows that those who have pre-existing trait anxiety are more likely to have a negative reaction to a traumatic event. So we know that from previous research that those youth who take an active coping response are more likely to be resilient and do well in the positive this. But to answer your question more specifically, what is this going to potentially do for us? Is I think it's to some extent it resets all of our baselines with a heightened level of stress. This is a world event, and so youth and everyone's we're all now been exposed to this very kind of world traumatic event, and so our baseline is changing. But hopefully we can adapt to that. And the brain is a resilient organ, and it can respond to many amazing things. But I think we have to be mindful of those things that we can do as individuals, as organizations, as communities, and as a nation that can foster resilient action. So there's lots of work to be done in terms of developing things that we can do to respond to this. I don't think we can bury our head in the sand and hope that we're all just going to be better after these things, but that we need to take proactive action based on science to address particularly the mental health issues, because I do think we're going to see a spike in mental health problems, substance abuse, and things like suicide.
Dr. Wright, I want to ask you how the pandemic, the economy, and the Black Lives Matter protests all combine and create a sense or perception of trauma for people, even if they are not impacted directly with job loss or a death, of a family member or something like that. How does this happen?
Again, thanks for having me here as well. I think it's not just the protests themselves, but what they represent. Right, what they represent is systematic racism as well as police violence against people of color. And so you have that combined with pandemic, combined with the economy, and you end up with, as a nation, we're being confronted with ongoing threats that don't seem to have an end, and that we don't have a solution for. And that just becomes very taxing on people. Like Dr. Silver said, I think we're reaching a point where we're so overwhelmed that we're wondering if we really can handle this as a stressor. But as both the panelists have already mentioned, we are resilient. We've had experiences in our life that maybe we thought we weren't going to overcome, like divorce or the loss of somebody, but we have. And so if we can remember that, I think that does help address the trauma of this situation.
Thank you, Dr. Wright. You work on the APA's Stress in America survey, and I know that you may not have results of the current iteration of that survey yet, but it is something that's in process. And what can you tell us about the methods of that and any predictions for what you might see in terms of trends in response to current events?
Sure. So we do our Stress in America survey as an annual nationwide survey. This year we're doing it a little differently. We're doing it as a monthly sort of pulsing check-in kind of survey. So we do have results from our first wave, which was conducted about a month and a half ago. And what we found was that for the first time in over 10 years, we saw a significant increase in average stress levels. So for the last 10 years, stress has really been declining to almost a plateau, and now we have a significant increase. And while nobody seems to be immune, certain groups are disproportionately affected. Those are parents with children under the age of 18 and individuals from communities of color are reporting the highest levels of stress compared to other groups.
Great, thank you so much. I want to go next to Dr. Olga Acosta-Price. You specialize in mental health in the education setting. And as we discussed earlier with one of the other panelists about students having a disrupted school year and a summer break that's going to be far from normal, how are parents and students coping with the uncertainty and these disruptions? And how is mental health in these kinds of cases being measured? And what are you seeing as an impact there?
Hi, so thank you also for having me. It's a pleasure to be with you. So as you said, and as has been mentioned, the stressors are really impacting us all, but what's important is that it's impacting us differently, and how we are able to handle them varies quite a bit. And some of the factors that help us understand how the stressors how these conditions are impacting us and that we can predict sort of that level of adversity is really determined by what you already had going on, sort of the exposures and risks that, some families, some children have already been contending with. So they were really already at a level of stress that maybe was higher than normative. How the current situation is actually maybe exacerbating our kind of ability to really function appropriately, and then what resources, either material, emotional, or social, that we actually have available to help us buffer the impact. And so, as you can imagine, as others I think have said, that does impact some of us disproportionately, particularly if you are from lower socioeconomic status, if you are an individual of color who's already historically been experiencing discrimination on a regular basis and structural racism. How folks, I think generally have been coping is first that we have, I think very naturally, folks first think about how to stabilize what's going on. So stabilize your home environment, stabilize, and so that means, do you have access to food? Do you have a stable home? How can you sort of make sure that sort of through that crisis you've managed? And then making sure that everyone's connected. And that means, to what degree do we have the resources, the tablets, the internet, the ways that families and students now have, for this period of time in the spring, have had to rely on being connected with each other, which again, some communities have disproportionately been disconnected from those kinds of resources. That has meant that they have had a much harder time engaging in schooling and learning. But what learning and schooling is for many people is not just a place to gain more knowledge, but they very much are very protective environments. They have a lot of individuals within them that are protective for kids, who are important for the social emotional well-being of kids. And so making sure that we also support people's familiarity with even how to use technology. There's varying levels of understanding how to use that technology so that we can stay connected, that we can do our healthcare visits, that we can meet with teachers. So there's a lot of that, again, that is going to disproportionately show up differently in various communities, non-English speaking families, and communities where there's fewer resources available. So I think the ability to cope is very much tied to many of those factors.
Thank you. To Dr. Kaslow, what mental health disparities are being exacerbated by these current events, and what would you do? How would you describe which populations, which demographics are at the most risk?
Thank you also for including me. So I think that the truth is we don't have a lot of clear information about this. There's some evidence that there's certainly more symptoms of anxiety, more symptoms of depression, insomnia. But if you look at the data from multiple countries now, you see that that's true for many people. There are some people that are sort of about the same, and there's a sizable subgroup in each country that's looked at this now that suggests that there are some people actually doing better during this time. There's a group of people who may appreciate the opportunity to be home more, or who find going out really stressful. And so being able to be home and not have all the social pressure is easier for them. Similarly, people with a history of mental health problems, there's no question that there's some people, this is making their anxiety worse, their depression, their psychotic illnesses, their substance use, their suicidality. But there are, again, some people with a history of mental health problems who are doing better, especially if they have access to the appropriate psychotherapy and medication, that they're actually doing fine or maybe even doing better. So it's variable. And again, the intersectionality with class and with race is seen in this regard, because people who have less resources, people are more marginalized communities, have unfortunately less access to much needed mental health services during this time.
Thank you, Dr. Kaslow. To Dr. Mavrides, how is the pandemic affecting people with mental health vulnerabilities or other conditions such as autism, and what can be done to support these patients better?
Thanks for, again, including me, Tom. But I think especially with the vulnerabilities like autism and developmental delay, these kids are really used to the structure and the routines of school and therapy. And so, having everything so disrupted, there's been, I think, a lot of families who have been struggling with increased aggression, increased agitation, difficulties with sleep in these kids, and then getting them off cycle can really be very disruptive, not just to the individual, but to the whole family. So some of the things that we're seeing in our clinics at University of Miami is that, these are the families who are asking for the most help because they've lost their in-home therapy, or, they're just not able to get all the services that they're so used to. And so we're really talking with parents about setting up a schedule, setting up structures, so that these kids have at least some idea of what's going on. It's harder in the kids, I think, who have, limited verbal ability or limited cognitive understanding. But even those kids are used to structure with school. So they can respond to a schedule that the parents are setting up. But, what we've seen an increase in our autistic patients getting hospitalized because of aggression towards family or aggression towards themselves. And so that's been a struggle, I think, for a lot of these families.
Thank you so much, Dr. Mavrides. I want to go ahead and start taking some questions from our media participants. I do see a couple questions in the chat. We'll come to you shortly, but first, a few questions that we've gotten from participants ahead of time. I want to call on first Deb Wood from Nurse Zone. And Deb, I'm going to make your audio live, and if you have a video, you can enable that. Please go ahead with your question. I think Dr. Kaslow might be the best person to answer this, so please go ahead.
My readers are nurses, and a lot of them are working on the front line. And I've heard there's some risk of PTSD and other long-term psych issues, and I'm wondering how real that risk is and what nurses can do to avoid that.
Thank you very much. So I've been spending a lot of time working on the front lines with our nursing staff at multiple hospitals now. And there's no question that the nurses who are working on the front lines in the COVID ICUs is intensely stressful. It's been profoundly painful. They've witnessed so much death. They've been working really long hours. They've had to be everything to these patients because other people aren't allowed in the room. And so they're the nurse and the nurse tech and the environmental services person and the food services person and the family often, because family isn't allowed to be there. And so it's very stressful. And there's no question that there's increased risk for a variety of problems, for anxiety, for depression, for acute stress disorder now, post-traumatic stress disorder down the road a piece. As has already been mentioned by panelists, many of these nurses who work in the ICU tend to be a very resilient group of people, and many of them are going to come out of this without a, quote, psychiatric diagnosis, but they have witnessed tremendous collective trauma and just trauma in their experience. And I think the more that we can honor them, that we can validate their experience, give them as much support as possible, give them opportunities to take care of themselves. I know there's a lot of concern now with some of the same people who've been on the front line being furloughed, and that adds to an additional stress for them. And I think being really mindful that they really need a lot of extra support, attention, but they also need ways to take care of themselves and to be honored and appreciated for what they've done.
Thank you, Dr. Kaslow. I want to go next to Jamie Reno of Healthline. Jamie wants to ask about over-prescription potentially of benzodiazepines. Jamie, you have a couple questions. If you could sum up those questions in brief, and we'll see which panelists are best to answer them.
Sure. Thanks for having me, guys. I think I sent you way too many questions on that email, so I'll try to dilute these down a bit. But the main thing I'm interested in, I'm writing a story, and I'm actually a little bit of a news here. I might be writing a book on this. I think we all agree that this pandemic, we also have a mental health pandemic, if you will, globally. And one of the results is a pretty dramatic spike in the prescribing of benzodiazepines, which I'm sure most of you know, all of you probably know, are the anti-anxiety medications, Zoloft and Ativan. And there's been a dramatic increase in prescriptions, and I think this is a dangerous trend because we're learning more now about how dangerous these drugs can be. They certainly are helping some people, but they also are very quickly catching up with opiates in terms of addiction and suicide. And I'd like to get your take on this, both the psychiatric and the psychologist take on this trend.
So there certainly has been some evidence of increases in the prescription of antidepressants, anti-anxiety drugs like the benzodiazepines that you mentioned, and drugs to help people sleep. And again, as has already been mentioned, this is a collective trauma. A certain amount of anxiety and depression is understandable. I don't think we want to call something a psychiatric problem when it is an understandable response to a stressful situation. And certainly medication alone would never be the answer for that right now. If somebody really requires medication in a monitored way, it can be very helpful, but certainly over-prescribing or prescribing for things that aren't really psychiatric conditions, but are normative stress responses is not going to be helpful. But there's a subgroup of people that can benefit.
Dr. Wright, what are your thoughts about use of benzodiazepines?
Yeah, I absolutely agree with everything Dr. Kaslow said. I think what we saw at the beginning of this pandemic, when everybody needed to social distance and change their routines, was an immediate kind of panic that people were experiencing and weren't sure how to manage that panic. And they reached out to physicians or whoever they were working with, and those physicians mailed them drugs because they didn't know how to handle it either. And that's unfortunate because benzodiazepines are so addictive that while they can be maybe an immediate response to panic for those who really need it, when not monitored well, and if somebody continues to use it as their coping mechanism, then you really have a recipe for trouble. And so I think where we are now is a better recognition of how our responses at the beginning of the pandemic are no longer effective. And I think this is another example of that.
Dr. Mavrides, what are your thoughts?
I agree with both, Dr. Wright and Dr. Kaslow, but I also feel like, being a child psychiatrist, we're a very underrepresented, specialty. And so, there's about maybe 10,000 child psychiatrists in the country. So many of the drugs that are prescribed are not necessarily prescribed by, child psychiatrists or psychiatrists in general. A lot of it is the family practitioners, the internists, nurse practitioners and other providers who are maybe dispensing these benzodiazepines as, preventative or kind of first line saying, oh, we don't really know what to do. We're going to give, Ativan or Xanax or, Klonopin. Whereas if they were to come to a psychiatrist or child psychiatrist, they probably would get different kinds of medication suggestions. So I think that is one of the bigger problems, that it's they're being over dispensed, but it's not necessarily by people who have trained in psychiatry or child psychiatry. It's by, general practitioners, because that's who's prescribing the majority of the, psychiatric drugs in our country right now.
Thank you, Dr. Mavrides. I want to go to another question from Bill Prasad at KHOU. Bill, would you like to ask your question?
Yeah, sure. Can you hear me?
Yes, please go ahead.
Okay, thank you for having this panel. I work closely with epidemiologists and physicians, and all of them are anticipating a second wave. Can all of you look into your crystal ball and tell us what we might see if we see a more deadly second wave among the mental health of people who have pre-existing mental health disorders?
Panelists, who would like to address that? A second wave potentially complicating further these mental health concerns. Dr. Kaslow, would you like to weigh in on that? I'm trying to get your audio to activate.
I see that
Go ahead.
I see that Dr. Weems said he wanted to weigh in on that. So
that's absolutely correct. Dr. Weems, please go ahead.
Thanks. I'm going to give a somewhat interesting response to that, which is that, our expectation with the second wave is a second, more difficult wave of mental health problems. But and linking to this idea of, that we weren't prepared public health wise as well as we should have been. And with a second wave, hopefully we will be a little bit more prepared. And so our research out of Hurricane Katrina and the subsequent hurricane that happened 3 years later, Hurricane Gustav, showed us this really interesting finding. When I was following a fairly large sample of children after the youth after Hurricane Katrina, Gustav happened, and we assessed them pre and post Hurricane Gustav, and I expected their symptoms to go through the roof, and I found the opposite to be the case. Their symptoms actually decreased. And what we subsequently kind of learned was that the Gustav event was like an exposure, like a therapeutic exposure event, where the experience of Gustav, for most, now I'm saying that it wasn't bad for some subsample of the group, but for most people, it taught them that they could handle it, that they were able to deal with this event, that what had been very horrible, or similar event at least, was very horrible, and they were able to experience a similar thing, but with less trauma, so to speak. And we saw their symptoms go down. And we actually learned that part of the reason for this was they began to think about the previous event in a slightly better light. And so it was a resilience actually building event. So my hope is if we have a second wave, we'll have a better public health response, and that response will in turn teach large groups of people that they do have that self-efficacy, that they have some resilience, and that they will know how to handle it.
Great. Thank you, Dr. Weems. Dr. Silver, would you like to weigh in on this as well?
Yes, I agree with what Dr. Weems just said, but I would also like to add that it's extremely important that we recognize that people's experiences, both in the first wave and the anticipated second wave, are not uniform. Many people will experience personal loss that they may not be able to grieve in their normal way. Individuals may also remain unemployed. And so it's important that we don't think about the public as a uniform group of people, but recognize that there are individual exposures and there are consequences for people that may impact how they do respond, both to the first wave and to the anticipated second wave.
Thank you. Dr. Olga Acosta-Price, with concerns in education and a second wave potentially further disrupting returning to school in the fall, or a return to school and then another emergency abandonment of the school year could clearly be a major issue. What would you have to say about that in response to Bill's question?
Yes, thank you. I agree. I think that the education system in many cases, as many of us know, took a fairly significant stance in most cases across the country in moving to distance learning and closing school buildings. And there's been a lot that's been learned, I think, about what was successful and what continues to be challenging about that. I think I mentioned a few pieces about that. This right now, as a number of schools now are officially closed, certainly districts and state agencies, and particularly local school districts, have been furiously trying to make plans and contingency plans about what it will look like to return to school, and also anticipating a second wave and how they can, then, as you said, close and again move 100% into distance learning. So I think part of what I wanted to mention is that maybe what makes the second wave a little easier to digest is that we anticipate the probability that it can happen again. And so that does mentally prepare us. It allows us to we've lived in many ways, and when I think about students and families, through a very disruptive, quick, and difficult period. So in some ways, we kind of have a sense of what that worst case scenario is. It's not as unknown. And so moving again to something where people have hybrid models of doing some face-to-face, some distance learning, a whole bunch of different kinds of models being played with right now and thought through. But if they have to move 100% to distance learning, again, in anticipation of keeping everyone safer, folks and families, students know what some of that feels like, and now are more mentally prepared, hopefully also have, the schools are more materially prepared. They can recognize where there are segments that need additional quick attention to make sure that they are connected and supported. So I think that's part of how we may see some of this play out in our public education system.
Dr. Weems, you'd like to add further to this?
Yeah, I was just going to highlight or underscore the point that Dr. Silver made, which is it's really, really important to realize that there are multiple trajectories of mental health problems. So when we answer these questions, the news media really need to understand we're overgeneralizing to people in general, but there's folks whose mental health problems will stay high and they'll continue to stay high after a second wave, or there's folks who will decrease, they'll show a response of resilience. And then there's folks who, stay, they were buffered the whole time, or they did well the entire way through. But so really thinking about this, when you think about the answers to these things, are the multiple trajectories that people's mental health and responses play out.
Dr. Kaslow, you'd like to add some thoughts to this as well. Go ahead.
Yes, so part of the question had to do with adults who had existing mental health disorders. And I really feel like we were not prepared to help that subpopulation very well at all. And I think that we need to do much better preparation. In many ways, it gets to the other question that has to do with the pandemic response and how do we integrate mental health with a public health response for any future pandemic response. For the general population, for people at various kinds of risks, one group are those with serious and persistent mental illness. And I think that we really need to do a much better job sort of helping people prepare, many people with serious and persistent mental illness have limited social support networks, and that was already mentioned about children who have mental health problems or developmental disabilities, making sure that there's a better support network built into play, making sure we move much more quickly to telehealth. For many people with serious and persistent mental illness, they struggle economically, don't have jobs, or live in very crowded environments. And so I think that many of the things that are public health-wise recommended in terms of physical distancing and the like are extremely difficult for them. And I think we really need to mobilize much more quickly and help them up front build the kind of resilience that they need to manage through such a difficult situation.
Dr. Kaslow, you mentioned telehealth. That's obviously been crucial in the almost immediately upon instituting social distancing and major interventions across the US and around the world. Do you feel that telehealth will and should become the new normal for most doctor visits as a result?
So I do not think that telehealth should become the new normal. What I do think is we need to move to a more hybrid approach where we take it on a situation by situation basis, a person by person basis, and figure out for this person based on what's going on in their lives. Maybe a telehealth visit would be best, and they have a bunch of kids at home and they can't leave them and get to the appointment. And for other people, there's really a sense that this two-dimensional space is not optimal for doing many kinds of really effective kind of work. But I certainly hope that our federal system, our insurance system will continue to support telehealth. We've seen it can be very effective, it can be very helpful, but I don't want it to just be this blanket kind of thing, let's move everything to telehealth. I think we need to really figure out who it works for, under what conditions, and do a much more individualized approach.
Dr. Mavrides, what would you like to say about telehealth?
I absolutely agree with what Dr. Kaslow is saying, and I think there shouldn't be that blanket one-size-fits-all thing for anyone in psychiatry, but especially with children, those who are from underserved populations or from lower people who don't have the internet capabilities or whatever. It's been very difficult to get them into a Zoom or even a FaceTime situation. And many of my private patients are absolutely loving telehealth because, their parents can be working and they can be in school and they can pop into the visit and then pop right back to what they were doing. But we've had a lot of issues with our community clinics and our patients who are under Medicaid and Medicare getting them access. So I do think that it's not going to be a one-size-fits-all situation, but I certainly agree with Dr. Kaslow and hope that our insurance providers, as both private insurance and public insurance continue to at least give this as an option, because for some people it really is wonderful, but for others it's been really, really difficult.
Great. Dr. Acosta Price would also like to weigh in on this.
I absolutely agree with Dr. Kaslow and Dr. Mavrides, and that there really should not be a blanket approach to this. But I think one of the benefits in school mental health, at least, that we've seen in working with children is that there are, again, some conditions or some circumstances in which telehealth has actually helped engagement and has allowed people to have better regular access to care. In addition, one of the challenges that has been really great in communities where school mental health is part of what is offered to support children and families, is that one of the greatest challenges has been engaging families, because much of those models have been school-based models, which we think really support access to care for children who otherwise wouldn't get it. But it does add a challenge about engaging families, and we know how critical it is to do that as part of that care. But telehealth has actually, in many circumstances, with the communities that we've been working with, we've seen that has actually opened up many opportunities to connect with families, to engage with them before they're young, because you can't actually access children in many cases, maybe some adolescents, but not children, unless you're that it's the family or the parent, the caregiver that's allowing that access. So it's actually then provided these opportunities for one to check in on the family's well-being, on a parent's own health and mental health, and resources they may need that we know will absolutely impact their child's well-being.
Another question for you, Dr. Acosta Price, on the subject of teachers and their relationship with students. Why is it so important for teachers to be conscious of and even maybe focus on their relationship with students and parents and the families that they serve, as compared to a focus maybe solely on or mostly on curriculum and content? That's obviously been, I think, on the mind of a lot of families in dealing with the emergency shift to remote learning, and with talk of a lot of schools potentially doing some combination of remote learning or maybe even exclusively remote learning. Planning for and preparing for that relationship maintenance. I want to ask you, should that continue to be a main emphasis, and why? And your audio. 1 second. Go ahead.
There you go. Thanks. Absolutely. So I'd love to sort of, I think, make two main points. One is that second only to families and caregivers, school adults, and so that means educators, any of the staff in schools, are, we know from the protective literature, risk and protective literature, that adults in schools play an incredibly important role in helping young people buffer the stress and adversity that they may experience, and that these relationships are incredibly protective against the kind of impact that we may otherwise see. And so, again, we also, if you combine that with the fact that we know that adult well-being is highly predictive of child well-being. So if we do concurrently, it's not to say one is more important than the other, but to neglect adult well-being, the well-being of the educators, of the adult administrators, and others in the building, I think is to really jeopardize how well we can, and the kind of, again, thinking as a public health person, how well we can actually improve the school population's well-being. And so efforts to support kind of adults' ability to engage in self-care, to support their own mental health and well-being, is going to impact entire classrooms, entire school populations in a positive way, to the degree that that's built in. But I think also because we want adults to also be modeling the kind of behavior that we want young people to be adopting themselves. And when they see people that they care about engaging in those practices, asking for help, taking breaks, attending to their well-being, that's very, I think, powerful for young people to then adopt. And then the last part is your, social emotional learning and mental health and well-being has taken a high priority in efforts to think about return to school. And in a way that I think for those of us who have advocated for this is an important part of education, have not seen an opportunity before. And so I think the continued attention, because we know that learning is such a social and emotional process, we want to make sure that we continue to support young people's ability to actually engage in their learning and actually retain their learning, which we know they cannot do or is very highly compromised when they are stressed, when they are feeling challenged in a negative way. We feel that, again, continued attention to social emotional development and processes is critically important.
Thank you, Dr. Acosta Price. I want to go to Dr. Wright, and we've referenced a lot of different topics related to current events, and I want to ask you a little bit about how people are responding to the pandemic and to the Black Lives Matter protests, and what that can signal to us about the psychology and mental health of our public discourse. And one of the things that's been really major in the news, or a couple of the things that have been really major in the news, are the backlash to social distancing and protests about reopening the economy, and then more recently we've seen these protests about Black Lives Matter and counter protests, kind of raising a denial that it's even a real issue. So I want to ask you about empathy, and if you see that empathy is missing from our culture in a certain way, or if there's some sort of deficit, and what can be done to improve that, and what you think that means about how people are responding to these parallel crises that are going on. And I got your audio here, if Zoom lets me unmute you. Thank you. Go ahead.
Sure. I think this notion of an empathy deficit isn't new. It's human to look at the world through our own perspective, but that needs to be balanced with our ability to understand the distress of others and then be moved to help alleviate it. And I think we are in a situation right now where it is all too easy to dehumanize other people, and to fail to take their perspective into consideration as we're confronted with the stressors that are occurring right now. And so I think some of the things that we need to be doing are to be thinking about what are the perspectives of others? How can I put myself in their shoes? How can I educate myself through novels or TV or movies about other experiences that are unlike my own? And it's not just empathy in and of itself that's going to solve some of these problems around our public discourse. It's balancing them with the other values that are important, like fairness and liberty. But I do think that we are suffering from a lack of empathy in this country right now, and that's due to a number of factors.
Dr. Weems, I'd like to ask you about these kind of converging crises as well, and in particular, is it your opinion that the Black Lives Matter protests have become so widespread because of circumstances as a result of the pandemic and the economic crisis?
Well, I think, can you hear me?
We can, go right ahead.
Yeah, I certainly wouldn't attribute it solely to that. I think that the response is something that's built up over hundreds of years of injustice. And so we're seeing, this coming to a head now, primarily probably because of fully being fed up with this. But I think to some extent that we did have a laser eye focus on things. So we were primed by this event, the COVID-19 event, to shift attention to something that we might all have some level of control over. So I think that the activism that we're seeing is a response in part to time and ability and desire to be able to do something to change the world that we couldn't do, as we're not not all epidemiologists, we're not working on a vaccine to stop the COVID-19 thing, but we can go out and protest. We can write our congressmen or senators. We can do things to change this injustice, which is pandemic in itself.
You referenced perceived control, and I wonder if you can expand on that and how that, or the lack of it, in relation to these current events, is a factor in people's response and how they cope with trauma, or how it impacts them.
I think we have very good data to suggest that the more perceived control and the more self-efficacy that we feel in events, the better we do in those events. So perceived control and self-efficacy is a protective factor for, mental health problems and a number of different health problems even. And so I think that we've very much felt with the COVID-19 thing that there was not much we could do besides social distance, and we could feel some level of self-efficacy about doing that, but then that was isolating us, and that was leading to great unemployment. And so the social isolation thing, I'm not sure was building much self-efficacy, but if we feel like we've seen something unjust and that we feel like we can go out and demonstrate and change what's going on, that's helpful. And so that it's probably fostered to some extent our sense of self-efficacy. And we're beginning to see some hopeful signs in the legislature and city governments doing things, taking action to actually do differently. And I hope there's a silver lining to that. If it was in fact connected, that it facilitated the intense outpouring that we're seeing, and that it helps maintain that intense outpouring.
Absolutely, Dr. Weems. It feels, when we look for that silver lining, that we don't want to downplay the severity of the crisis that people are going through, but it also is a little bit cathartic to see people really get motivated and active. So thank you for your thoughts on that. I want to go to Dr. Silver. How do you feel that conflicting information we've seen in media coverage of the pandemic, as well as other topics that we've referred to, that there's conflicting information being put out there, either in media or by even public officials, or even not necessarily attributing nefarious motives, but even just changing information, changing data can also create a certain level of confusion, or harm the public's ability to parse out what's true and what's not, or deal appropriate with these kinds of events. What do you think about that? What can you explain it a little bit for us? And what do you think can be done to combat misinformation?
I've been thinking about this quite a bit, because I think one of the challenges of this novel coronavirus is that it is so new that the science, the information that we've learned from the scientific community, has been changing very rapidly. So at the very beginning, the message was that individuals could only shed the virus when they were exhibiting symptoms. That was revised. Information originally suggested that, or we were informed that there was no use or value in using face masks, because in particular, those needed to go to the healthcare providers. And because the science has shifted, people have found it very difficult to know what's the current messaging. And I think that it is extremely important that the public use the information that is coming out of the public health system, as opposed to public officials who are maybe politically motivated to share messages that may conflict with the science. And as a scientist, I strongly encourage people to use the public health information that is often very effectively communicated by the media. In the absence, however, of clear, consistent messaging, people often can seek out what they want to hear. And if they are confused, they're much more likely to listen to a friend or something that they read on social media, because there isn't a consistent message that's coming from our public officials.
Thank you, Dr. Silver. Just a quick note for everyone. We are at the hour mark, but due to kind of a few hiccups and some disruptions, I really hope that we can squeeze in a few more questions for our panelists, and we'll go a few more minutes than the hour. If you need to exit the meeting, we totally understand, but we want to continue with a few more questions. And especially media, if any of you on the call have more questions, please do chat them to me, and we will invite you to ask those questions. I want to ask Dr. Wright and any other panelists who want to also weigh in on this about an uptick in substance abuse, alcohol or drug use during the pandemic, whether it's people who are dealing with addictions to those things or even just recreational use that can affect people's mental health. What are your thoughts about that? Is that a major concern? Have we seen data about this, and what would you say about it?
Yeah, we have seen some data on it, mostly from what we know from the beverage companies, which are saying that they have been selling a lot more than in the past. So obviously people are buying that. I haven't seen necessarily any data on people's consumption and how it's affecting them, but I think we can expect that, yes, people are drinking more as a way to cope and respond to the situation. And while that's very human, it's not very effective generally. And so I think people really need to be mindful of how they use alcohol or smoking or other sorts of substances to help them manage with their stress. Be mindful of how often you're doing it, when you're doing it, and why you're doing it. And certainly if you are somebody with a pre-existing substance use issue, this event can be very triggering, and we're very concerned for relapse, and encourage people to also seek out telehealth options around AA, if that's been a source of help for you. Many AA groups have gone online as well. So again, it's really about finding effective ways of coping with the stress from the situation, including reaching out and finding those social connections.
Thank you, Dr. Wright. Dr. Acosta-Price, you'd like to weigh in on this, and I've clicked the button to unmute your audio. Go right ahead.
Thank you. So no, I absolutely agree with Dr. Wright, and just wanted to kind of reiterate the point that I think was made earlier, that it's important, again, if we're spending much more time in our homes, and children really observe and imitate a lot of what they would see. And so to the degree that caregivers are utilizing maybe unhealthy coping strategies, or at least unhealthy in the long term, they may be sort of in some ways good temporary measures of sort of getting through difficult periods, but if that isn't balanced with other coping strategies that young people can learn about, can witness, can see, and then can adopt to themselves, I think it hopefully provides more encouragement to those of us as adults to not just talk about using those coping strategies, but actually do them. Make sure we get enough sleep, make sure that we find some time to exercise, that we stay connected to people emotionally, even if we can't be with them physically, that we talk out some of our problems, that we, all those kinds of things that, again, may seem very basic and very natural, but are very powerful in helping us adapt to challenges and to stress. And so we, hopefully that will encourage adults to try to find some balance between, some of those temporary kind of measures and what we hope to be long-term healthy strategies for coping.
Thank you. Dr. Kaslow, I'd like to ask you if you can compare a little bit for us how the pandemic is affecting people that have dealt with mental illness versus those that haven't. People who maybe have already dealt with anxiety and depression, are they being triggered by these circumstances? Or maybe do they already know some of the tools to deal with these things and they're more equipped to deal with it? And then what can you say about people who have never dealt with anxiety and depression? Are they presenting with symptoms, and are they maybe experiencing these kinds of things for the first time and they're not quite sure how to handle it?
Well, there's definitely people who are experiencing anxiety and depression for the first time, who are seeking help, who are reporting symptoms for the first time. They're not even sure what it is. They just feel uncomfortable. They feel that kind of panic that was mentioned early on, this sort of sense of being out of control that people have already talked about, things being so uncertain, unpredictable, the stress that they may have in their own lives that has to do with juggling work and children, or unemployment, or being on some front line that's really, really difficult. And so there are definitely people who are presenting with symptoms of anxiety or depression, or even getting a diagnosis of one of those kinds of problems for the first time. And they really need help. And you can see mental health programs popping up everywhere where people are offering, crisis calls, text lines for teens, for adults, that the numbers have just skyrocketed for people texting, calling, and reaching out for counseling. In terms of people who already have a history of depression and anxiety, as I mentioned before, I think that's going two ways. There's a group of people where this is really bringing up prior traumas or prior situations where they were really anxious and depressed, and it's reawakening that, making it worse, just like it was mentioned with the substance abuse. There's some people who are really vulnerable, and the stress upon stress upon stress, that sense of being overwhelmed, if you're vulnerable to anxiety and depression, there are some people really getting worse. But again, there are a group of people where maybe because everybody else is overwhelmed, they don't feel so unusual, they don't feel abnormal, they feel more connected to people because now they're not the only one having obsessive thoughts or ruminating or, quite frankly, washing their hands so much. Or afraid to go out and trying to figure out when it's safe to go out. They've got a whole world having those same problems, and they actually feel more bonded and more connected and are reporting less stress.
Thank you, Dr. Kaslow. I saw a really relevant post on social media early on in the pandemic that I found really relatable about, somebody who had dealt with severe mental illness and other kind of family trauma, saying, I'm able to be calm during all of this because my life has already been a certain level of chaos, and now everyone else is freaking out, and I'm as cool as anybody. They didn't quite put it that way, but that was the gist of it, and it was going viral on Reddit or something like that. Dr. Mavrides, as we're trying to deal with this uncertainty, as we're trying to deal with this low perceived control that Dr. Weems was talking about, we are consuming probably too much news and too much social media. Why is watching too much news and scrolling endlessly on Reddit potentially creating that sense of trauma for people, or at least increasing it, even if they themselves are not being impacted directly by something? And what would you suggest about taking breaks from those kinds of things?
So great question. So, I think that the amount of news access and the amount of news availability right now that's covering the pandemic, the Black Lives Matter, the various different protests, it's all consuming. And so, what happens is that you watch one thing or you watch two things and you kind of get sucked in. And so even though it may not be happening in your town, or, the pandemic might not have reached the same levels in your state as it did in, the Northeast or out West, it feels like it's happening, so close at hand because you're involved in this news media. So the trauma that all these other people are experiencing, you kind of feel it too, because you feel like if all these news, services are reporting it, it has to be happening and it has to be impacting you. So, especially with kids, kind of these chronic and persistent exposures to these kind of, either violence or kind of hearing about death, it can lead to fear, and it can actually increase, aggression, in kids that are watching these things so much. People don't always understand what they're watching. They may get their news, from only, one news source. So they may not be hearing the different opinions that, some of the other public news sources are putting out there. So the trauma that comes, can be really collective and can be long lasting. Some of the things that we're recommending to both adults and to kids is to not kind of scroll aimlessly through Reddit for hours and hours on end, although you can definitely get there. But, maybe to set times to check the news, to see whether or not, whether you do it 3 times a day, maybe morning, lunchtime, and evening kind of after dinner, so that you're at least getting caught up on what's going on, but you're not getting alerts kind of all day, every day. With parents and kids, it's really limiting what you're doing and how much screen time they're having. We know that kids, especially over the summer now, there's not much else to do, but they don't need to be on their screen and on their news media kind of all day, every day. So just by really putting some limits in place can be really helpful for kids, but adults kind of have to police themselves and really kind of put the limits on and not allow themselves to be bombarded by, you know, the negative stuff all day.
Thank you, Dr. Mavrides. And I'd like to thank Dr. Mavrides for joining today. I understand that she needs to go because she has clinic hours. So
Yes. Sorry, my phone is blowing up right now from my
I
phone.
totally understand, Dr. Mavrides. We don't want you to keep your patients waiting. Thank you so much for joining us.
Thank you so much for having me.
Thank you.
Bye-bye.
Dr. Wright would like to also weigh in on binging too much news and social media. What would you like to say? Let me get your audio live. Sorry, go ahead.
Thanks. Yeah, I absolutely agree with all of that. I think one of the challenges with the uncertainty of this situation is it reminds us of all the things that are outside of our control. And so one of the ways that we try to regain control is through reassurance seeking. And that's really, I think, what people are trying to do when they're compulsively looking at the news, is they're trying to find new information that's going to make them feel better. And the problem is there really isn't any new information making us feel better right now. And instead, we're just reading the same things over and over and over again, which is actually maintaining our anxiety, not reducing it, and keeping us in this state of hypervigilance. So I absolutely agree with all the recommendations. I think we need to be putting our devices down. We know from research that being constantly connected to our devices in and of itself increases our stress. And then you add a pandemic with a pandemic on top of it, then it magnifies it. So, you know, setting times aside where you just maybe read the news over lunch and then you let it go, turning off your notifications, modeling good behavior for your kids. So if there's a no device time in your house, both you have to model that too. You have to put your device away. And don't just rely on willpower. Put it in another room. Keep it far away from you so that you're not just mindlessly grabbing stuff and looking and scrolling and losing hours and hours and hours again. It's just not a very effective coping response.
Thank you, Dr. Wright. I know that Dr. Kaslow and Dr. Silver both need to depart for other commitments, but I do have a couple of other questions, so I want to thank them both before they leave. Dr. Kaslow at Emory and former president of APA, and Dr. Silver from UC Irvine and a fellow with the Association for Psychological Science. Thank you both so much for joining. One more question for Dr. Weems. What can you tell us about modeling for suicide, and are you seeing predictions potentially based on those models of an uptick in those events? And your audio will be live in just a second. Go right ahead.
Great. Yeah. I'll add one more thing, which is that I know that my own mental health has improved as I've not watched less news. Not to plug you know, news outlets for my mental health problems or whatever. But yeah, and well, early on, what we tried to do was there was quite a few individuals talking about concern about suicide rates increasing because of the pandemic. And so we looked at two kind of previously known predictors of increased rates for suicide, which is unemployment. So people who are who become unemployed, who are unemployed, are at an increased risk for suicide, and then also social isolation and feelings of isolation is a risk factor. And so so we created a model kind of based on what we were seeing in terms of the amount of unemployment and the number of folks who were under social isolation orders, and kind of created a model. And you know, immediately the model is out of date for the world and in the nation, because there's the numbers of unemployment is constantly changing, and the number of folks who are under isolation. But we try to predict, we try to use those previous models, and our models do obviously suggest that we should see an increase in suicide unless we take action. I think, you know, there's all these resilience factors that we talked about, and there's things we can do. My colleagues who are psychiatrists and public health folks are involved in those kind of efforts where we trying to get, you know, the mental health services to folks, to reach out to our friends and colleagues who might be impacted by social isolation or loss of employment, and helping to lift them up. So I'm hopeful that my model does not come true.
Indeed. Thank you, Dr. Weems. I want to take time for one final question, and then we'll wrap up with a few notes. We have with us a student from Duke University and also an NASW intern who's working with one of our Newswise members, training to be a future science writer. And Jordan has a question for Dr. Wright. So Jordan, I'd like to invite you to go ahead and ask your question.
Hi all, this is Jordan, and I'm a student, like you said, at Duke University and an ASW intern. So yeah, my question really ties back to addiction. And so as we all were talking about with like the addictive medications and those sorts of things, like how do we sort of access those people in those communities and sort of bring like a community environment to those sorts of people that might not have the necessary resources that are available to like a lot of the different people of these groups that we've been talking about?
Go ahead, Dr. Wright.
Yeah, thanks. I think it really piggybacks on what Dr. Weems was just saying, is that it's really incumbent on all of us to reach out to each other and to see how people are doing, and not just ask how they're doing, but really listen and really see where are there gaps that we can help fill in, whether it's resources, whether it's a connection, or just being there for somebody. I think that we know that one of the biggest buffers to stress, whether it's this level of stress or just the normal stressors we experience, is social connection. And so we need to be creative about how we use virtual connections and technologies to really reach out to people and to see how they're doing and help shore them up and make sure that particularly those that we know are most vulnerable don't feel like they're alone. Even if we are in social isolation, it's not the same thing as loneliness. Loneliness is a perceived sense of not having that connection, and we can be the community that wraps our arms around people and really helps them stay as mentally well as they possibly can.
Thank you for your response, Dr. Wright, and thank you for your question, Jordan. I want to toss it to my colleague, CEO of Newswise, Jessica Johnson.
Hi, everyone. Thank you so much for joining and participating today. I'm sorry for the interruptions, and thank you for being so patient. We were having kind of a whack-a-mole session behind the scenes of trying to get people out, and it was, I guess, a little bit stressful. So I appreciate, Dr. Weems, your comment about even in these moments having a sense of humor. So thank you all, and thank you to everyone who joined. And I hope you guys have a great day.
Thank you, Jessica.
And Tom, you did a great job in handling that. Thank you.
Thank you very much. I appreciate that. Thank you so much to all of our panelists, Dr. Kaslow, Dr. Mavrides, and Dr. Silver, who have all had to go on to their busy days. And we were lucky to have also with us Dr. Weems, Dr. Acosta Price, and Dr. Wright. Thank you so much for sticking with us for a little bit of extra time to answer those final few questions. We really, really appreciate it. These are such unprecedented times, and all of us are suffering or struggling in one way or another. And, you know, I debated about what to say about this, but I will go ahead and say it. I've dealt with anxiety and depression all my life, and these moments, because of this pandemic, have exacerbated those things, but they've also, as some of the panelists have said, created a little bit of sense of solidarity with people who are maybe a little bit more sympathetic to some of those struggles. And it's very important, I think, for us to have visibility about these issues. This is a big reason why we wanted to do this panel. And all of you have really contributed to that conversation in a very positive way, and we really appreciate it. So thank you. To the media who are on the call and have stuck with us, thank you. We will get you the recording and the transcript of this as soon as possible. And with that, I will say thank you. Good luck. Stay safe. Stay healthy. Have a great rest of your day.
You're very welcome. So long.
Thank you.